Okay, thank you, ladies. My life as a medical assistant. I was in the ninth grade when I decided to watch a TV commercial showing that there was six soldiers on the show. And I decided then that that's what I wanted my life to be, to help sick people. For the first I've been in the medical field for 15 years. And out of those 15 plus years, I really enjoy what I've been doing. So becoming a medical assistant was very important. If you want to, before you decide to take this journey or this field to become a medical assistant, do your research in the field. Being a medical assistant has a lot of advantage, but right now I'm going to tell you a few things that helped me to become a medical assistant. Once I found the school that was convenient for me, I scheduled an appointment to go out and meet with the counselor. Once I did that, I took a tour of the school and I was able to ask her questions concerning the school, how much it would cost, how long it would take me to complete this course. So once you have that, and also you can do medical assistant online in the evening and in the morning. The classes is at your convenience. Once you have all of that situated, then you will be able to have where you will have your classes. And I'm going to tell you a few things about the classes that you will be taking. You will be doing vital signs, which is taking the pulse, temperature, blood pressure, respiratory, as well as the height and weight. You will also be doing an EKG, which stands for electrocardiogram. You will also do venipuncture. That's where you would draw blood from a patient for blood samples. You will be doing medical and surgical aseptics. That's to learn to stop the spread of organism. You will also do medical terminology. That's the words you will use in recording as well as talking to patients. It's just ways that will help explain the body more to the patients. Okay, now that you're finished with your classes, then you will go off to the lab. The lab is a place that you will go to perform the duties that you've learned in class on each other. It's better to learn on a human than to do it on an animal, or a dummy or a fruit. And that way you will get the response that you will need from the patient or the provider there the teacher there with you. Another thing with doing that, it would also let you have the feeling of knowing that you're ready to go out into the field. Then after, your lab, you will go to have your externship. An externship is when you go out to perform the work, what you learned in class at a job site. Most clinic has contract with these centers that allow their employees to train the students that comes in with them. When you go on these externship, treat these externship like a job, because you never know who's watching or who's willing to hire you on as a worker. Once you finish your externship, you can go take the exam to be certified or registered. That test you can usually take that test online, and you get the results right then and there. After you become certified, you're responsible for CEUs. CEUs is continuing education units. Once you're doing that, each certification requires you to have so many hours done in so many years. So once you do that, you have to keep up with that as well. There is a fee, every year fee for you to pay to keep up with your certification. After that, there's some specialties that you can go into if you don't want to remain. Well, if you want to remain a medical assistant, but you want to specialize in a field, you can go to work in. There's oncology, and that deals with the patient with cancer. There's pediatric, deals with the children. There's adult medicine, deals with elderly. The field is wide open, and they're always willing to, work with you. And another thing, you don't have to remain a medical assistant. You can also move on to become an LPN, which is a licensed practical nurse. You can become a RN. The list goes on and on. And then if you want to know what it's like what life was like what life was like before your time, what you can do is talk to a patient who's